Welcome to the Administration Committee here on Tuesday the 14th of October in Committee Room 6. We've got our second session on health and well-being. Our first panel today is going to talk about the Westminster Gym, and we welcome them. Morning everybody, I'm Nick Smith, I'm Chair of the Administration Committee. Thank you for coming to our committee. Today we're looking at how the gym supports physical and mental health of our parliamentary community. We welcome our guests, Jon Giles, Wesley Auvache and Lauren Kirk, who we'll now invite to introduce themselves. Who wants to start?
Chair, good morning everyone. My name's Wesley Auvache. I'm the Parliamentary Logistics Manager in the House of Commons and a Senior Contract Manager. I've worked for the House Service for 15 years and for the last 8 years I've been managing the gym contract. I'm also a mental health first aider and I'm a keen recreational long distance runner. Thank you.
Thanks, John.
Thank you, Chair. I'm Jonathan Giles. I'm the Chief Executive of Jubilee Hall Trust. I've been with the charity for 23 years and I've been working within the parliamentary estate for approximately 19 of those years, overseeing the Westminster Gym. I joined the not-for-profit sector, the trust sector, because I fundamentally believe in reinvesting the funds generated from health and fitness into community activity. I'm quite passionate about that. I have a background in sports science. I'm a mental health first aider, a menopause champion and a safeguarding champion in the workplace. Thank you.
Thanks. Lauren.
Thank you, Chair. Morning everyone, my name's Lauren Kirk. I've been with the charity now for 2 years. I transitioned into management as of May this year for the Westminster Gym. I started this career about 2 years ago now. I've always been passionate about fitness, and within the last year and a half I was really passionate about influencing other people to be passionate about fitness, so that's why I'm here now. Thank you.
Thank you all for that. John, first question to you. Tell us more about the Jubilee Hall Trust, please.
Jubilee Hall Trust has been established in Covent Garden for almost 50 years. It was set up primarily to improve the health and well-being of its local community. Since its inception, we now operate sites in Hampstead, Belsize Park, in Southwark near the Oxo Tower, and in here. Our fundamental belief is people should have access to physical activity, and we try not to make cost a barrier to that. So we run subsidised classes, subsidised membership fees for those who cannot afford to be a member of a physical activity space. We sell premium memberships to those who can. We have been a member of Community Leisure UK, formerly Sporter, for over 20 years. And Sporter is the membership council, or Community Leisure UK is the membership council for the trust sector, representing all leisure trusts in the UK. In 2024, the Community Leisure UK reported 5.4 million unique user visits to the trust sector, generating over £1.59 billion in social value. Our sector reinvests its money back into community activity, and typically our sector helps support those in the top 4% of social depravity get access to physical activity in open, inclusive spaces. I'm sure I'll come on to more as the session carries on.
Over to you, Lauren. I've got a bunch of sort of questions here. Okay, if I pitch them at you,
Yeah.
and then we'll see how we go.
Yeah, sure.
Thanks. Want you to, because you've got the day-to-day experience, for you to please talk about the membership and usage of the gym. Mm-hmm. Can you tell us about the pricing options, and is it possible to do weekly passes, and how many members there are broken down by gender and age?
Yeah. So for our gym we've got a couple of options for memberships. We have direct debit memberships or annual. Our direct debit is £40 a month, and we have an off-peak as well, which is £30 a month. We also, you can add £5 each month to include towel hire as well, which is...
Interrupt, I didn't know what you meant by off-peak.
Off-peak, so instead of being able to use the gym for the full opening hours, you can only use the gym between 9 and 12 and 2 and 5. Yeah. So it's £10 cheaper a month. So you can add £5 each membership to include towel hire. For our annual, this is £440 a year, and then we have an off-peak annual as well, which is £320. So you can also be a casual user You don't have to have a membership. This is £10 every time you want to use the gym, or you can do a block session. So you can have 10 sessions for £74. And then moving on to the usage of the gym. So we have our ratio of male to female. So we have 74% male users in the gym, and we have 26% female users. Our average age is 41, and our largest age group is between 26 and 35. And then you said about weekly passes. So we currently don't have weekly passes. However, if there's a demand for it, this is an option we can consider. At the moment, we have our casual, which seems to benefit a lot of people, but yeah, a weekly pass is definitely an option.
Okay, thank you. A few more sort of in the detailed questions. How many of your members are MPs and peers, and how many members new members elected in 2024 have joined the gym, do you know?
So we have no official stats for how many MPs and peers we have, as we don't take this information once signing up. We gathered some information. What I can tell you is in the year 2025, we don't know whether they are gym users or just, whether they're membership or just casual users. But there has been 13 MPs that have used the gym at least one point in 2025.
13, 1-3?
1-3.
Yeah.
13,
Okay.
yeah.
You don't know how many new members have joined?
So again, we don't know how many new members. We do know that last October, so October 2024, we had our largest joining rate. So we had 71 new members. Our largest joining rate since then has only been 49 members, and that was this January. So we had a peak last October, a significant amount of new joiners, which I'm assuming is due to the election.
What does usage look like in a typical sitting week when Parliament sit in? When are the peak usage periods? And are the current opening hours, do you think, meeting the needs of MPs and staff?
So I think the current opening hours do meet the needs. Our opening times correlate with the sitting times. Our busiest times are 5 p.m. and 7 a.m. So during this time, the gym is its busiest. There's slight crowding in the male change rooms, I'd say, just because of the high number of male users compared to female users. So I know, looking at the stats, are 7 a.m, just before 7 a.m, so 6 a.m. to 7 a.m, we do have users coming in then as well. And then the last hour of the day, so between 8 and 9, is our lowest rate of users using the gym. So potentially in the future, we could maybe think about opening the gym earlier, because I know from feedback from members, there is a demand for earlier opening times. So that could be an option.
Okay, thank you. You know what, I think I asked a question, but I didn't take a note of it. Did you say how many members you had?
560 members. These are members on a direct debit or annual membership. And then we have 22 casual users, so who are just using the gym on a casual basis. Okay.
And then last question for me, although it may be that Tessa and Kirsty want to come in. How well attended are the fitness classes? Can you pay as you go? Are there going to be more or different types of classes? And can you promote classes to specific pass holder categories to encourage people to come as a team, or MPs to come in groups where they're trying things out or just working out together?
Yeah, so our class numbers, we can only hold 8 people in our studio anyway, so our class numbers are quite low. At the moment, we have our class timetable and we're thinking of adapting it, so we don't want to just in the future have just classes. We're thinking of maybe having like workshops, educational workshops to help people get into fitness, weight training, nutrition, anything like that. But that's a vision at the moment. For casual users, they can go to the classes as well. They don't have the same benefit as a gym member. Gym members can book a week in advance, so casual users can't do this, but casual users can still use our app to see the availability of the class. They can see how many spaces, and they can still book themselves on the day. Luckily, our classes are hardly ever fully booked, so most casual users are able to get space onto the class. And then you said about specific categories. I would encourage this. I think this is a great way to get people to come down, use our studio, and actually use our classes. At the moment, a lot of our classes are lunchtime, which doesn't suit a lot of people. Due to our lone working, we can't, at the moment, do morning classes, which the demand at the moment is for morning classes. So we're thinking of getting external instructors to come in and do morning classes for us. That obviously isn't the reality right now, but that is a future goal. We, at the moment, have a really good community down there. We have groups, like teams, colleagues coming to classes together on lunchtime. We also have, for example, we have Weights Construction. They book in a yoga class or a spin class with us outside of the timetable, and they request to use our studio and have a class on their, basically their availability. So I think moving forward, we could definitely have the option of people booking in specific classes for them, for their teams, or we could have something on the timetable for specific pass holders. That's definitely something we can do, yeah. Thank you.
Tessa?
Thank you. Can I just check if Kirstine's questions come out of the responses she's heard already? Do you want to go first?
You go, Christine.
Yeah, I'm happy to ask. Thank you. I was just wondering about the additional services that you have available. I know that there are some treatments and therapies that are available. Are these available to non-gym members, and how are they promoted? Because I personally haven't seen that much.
Yeah.
And I think there could be demand there.
Definitely. At the moment, it's just promoted in the gym. You can use these services without being a gym member. So we have Technique, who they run the physiotherapy in the gym. They offer 15% if you use their code like in the gym. However, as a casual user, you can come in and you can still use that code and you can still get discounted physiotherapy. So yeah, we probably should find a way to promote this better throughout the estate. And then the other services that we offer, classes on the timetable, that would be as a gym user. So whether you're a member or a casual user, you'd have to be a member of the gym, paying to use the gym to use those services.
But the additional therapies and treatments are open to everyone.
Yes, yeah.
Yeah, I think it would be helpful to
Also
see them advertised more widely.
Yeah, definitely.
Thank you.
Yes.
Thank you. I think my questions are probably for Jon, although I recognise you might not be on top of all of the day-to-day workings. But I have been speaking over the months to a number of our staff members who are not the best paid people in the world, as you will understand, I'm sure. So I think I have concerns really about cancellation charges and what the staff refer to as extra charges. So, if I may, I've got two particular situations. But I want to understand, first of all, our staff are told that there's a cancellation month needed to protect the Jubilee Hall Gym due to its charity status. What does that mean?
So we don't like contracts. We try and stay away from contracts. So the way we have a membership from point of joining is people pay a double direct debit on their first payment. So on their first payment to the charity as a member, they pay twice. 1 month is for the month they're using, and that will roll on forward, and then 1 month is held as their cancellation month. So when a customer cancels, effectively they cancel and have another month to use the facility. The challenge we face is that if someone's been with us a long period of time, or they want to cancel, they often want to cancel and leave straight away, and they have actually allocated that month payment in hand. We have another situation where we run our membership on direct debit, and with the direct debit instruction, there's a date by which you have to send the direct debit to the bank. And if someone misses that cut-off date, we already make the collection. So there's sometimes a period when someone wants to cancel, and we've already then collected their membership fees, and they also then hold this membership on account. Now, how we articulate that to the person, we will always give a refund to those people who need to cancel, and it's last minute. Of course we would. We don't like contracts at all. It may be that staff are articulating to the customer in a way that they feel is the best approach to do it, but essentially the 1 month paid in notice is held onto account for their 1 month in lieu, and there's a cut-off period which we could probably notice board that better to people about when the cut-off period is for membership. But in all situations, we will always give a refund back to that customer. And of course, there is a process to protect the charity, but as we'll come on to later, the payments from those customers aren't going into my charity. They're going into a pot of money that is used to run that Westminster Gym.
They're told that the cancellation month is needed to protect the Jubilee Hall Gym due to its charity status. I don't understand what that means.
That may be just the way that the team are presenting it to the customer, and that's something we'll take back and talk to them about.
Thank you. So I have a situation where one of our staff joined the gym on the 26th of March, and they paid £49.03 to cover the remaining days of March and the full month of April.
Yes.
Okay. They cancelled their membership on the 30th of April, the end of April. But apparently the key date seems to be the 20th of the month, and that seems to be a continuous thing that keeps coming back. So the cancellation having been made after the 20th, they're then charged for the following month, and they were billed £81.90 on the 1st of May to cover May as well, and the cancellation month, which, anyway, on the 1st of June, they were charged an additional £40.95 for June, as the gym requires a minimum membership of 2 full months. And after they complained, admittedly, the June charge was refunded. However, they still paid £130.93 for 34 days of gym use, which is quite steep for ordinary staff.
I totally agree, Tess, and thank you for raising it. That point, I will look into this personally, and I'll report back to you on it, and I'll speak to the site staff on it to make sure we're doing that properly.
It doesn't quite fit with the charity's social mission, does it? And you've made comments about ensuring that it's accessible.
Quite right, I totally agree. I think when someone's joining, this 20th of the month cut-off is around setting up a new direct debit with the bank. So when you join after that setting up period, which is the 20th, and the collection is 3 days later, they pay a pro rata for the month in hand and the month ahead. Then their first direct debit, which would then in that case be 6 weeks later, they pay a double direct debit. So they're paying that 1 month in hand along with their month for, in this situation, May, I think. So when they gave notice to cancel, they have technically paid that month in hand, which would then be for, I imagine in this case, June. So that is us just making sure that that customer understands what payments they've made and for what period, but fundamentally making sure that if that customer wants to leave, then we fully support that. And I think I'll take away the comms to staff on that.
It sounds a fairly complicated individual case.
No, this is a pattern. I've chosen one of several.
Okay.
So, and I have one more that I'd just like to, forgive me, I just want to be, I think it might be helpful if everybody understood that the key date is the 20th of the month. I think it'd be really helpful for people to understand what they're going to be charged and how it's going to work. But I've got another one who wanted to pause their gym membership in June ahead of the summer recess. They were told they couldn't pause it for July, as they asked after the 20th of June. And then when they returned in July to cancel their membership for August, they were told that wasn't possible because the manager was on holiday. Both of these situations have been caught up with the manager being away. Forgive me, I'm talking about you, but it's not very fair. I wonder whether it's the case that authority needs to be delegated, because if only the manager can make a decision about something and you go in and you can't talk to anybody because you have to have time off and you have to have holiday, I understand that. Maybe you need a deputy manager who has the authority, or somehow you need another, more management cover so that staff can talk to somebody when they turn up.
Absolutely.
Have you a view?
I do. Firstly, I would thank you for bringing these to my attention. I think that this is, customer service for us is critical, and somewhere along the lines we are just not delivering that in the very best way possible. So allow me time to go and speak to the staff on site. To me, this is a full staff review, so that all members of staff can handle any inquiry straight away. We try and run an organisation that our people on site should be making those decisions, and I think that's just about me making sure that we have that training in place and people understand that, and also making sure that what we publicise to people about cut-off dates is well publicised and well explained.
And I think it's certainly the case that, in my experience from having spoken to people about this, that you can't do anything before the 20th of the month and you can't do anything after the 20th of the month. You have to be there on the 20th to get, and that's not realistic. Or it
isn't, and it isn't realistic either. I think it's just the fact that we need to articulate that better, and I don't think we've done a good enough job of that clearly.
Okay, and then the last comment I had, and this is a direct quote, not my wording, there was quite a lot of concern about everything being a bit of a faff, and for ordinary, pretty low-paid staff, you can charge the MPs what you like as far as I'm concerned, because we earn a reasonable salary. But I think it was that whole business of extra charges being a real put-off to potential gym users, and whether I think it's probably about clearer communication and an absolutely clear idea of what it is you're in for if you're joining up to the gym.
I totally agree.
Thank you very much indeed. I'll look forward to hearing from you further. Actually, the chair will. Thank you.
Thanks, Tessa. Thanks, John. Thanks, Laurel. Good. Helpful. Mary, please.
Thank you, Chair. Could you please tell us how you survey the membership in order to get feedback on current services and potential changes to services?
So at the moment, we don't have any surveys for current users of the gym. We have feedback forms, so when members cancel, they can give feedback. I get a lot of feedback from via email, and obviously the House of Commons, the compliments, complaints, comments system that people can use. Moving forward, we want to be more proactive at encouraging current users to give feedback. I think at the moment the vision of the gym, it's changing, and I think once we have a clearer picture of what that is, we can ask for more specific feedback about what people want, whether that's classes, opening times and stuff like that.
There's a commitment to do that.
Yeah.
Thank you. Wes, could I ask you specifically, how much does Parliament subsidise the gym?
Okay, so the House is contractually obliged to compensate Jubilee Hall Trust for any losses they incur from operating our gym. In the previous financial year, 24-25, that compensation was £22,000. And those losses are predominantly due to membership numbers not being at a level that allows the service to be self-sufficient.
But can I ask, is there potential to partner with other gyms so that users, especially MPs who spend part of the working week in their constituency, can pay one membership for use on two sites? Is that
currently, if you're a member of the gym here in Westminster, you can use the gyms, 3 other gyms within London, not beyond that. So Hampstead, Southwark and Covent Garden that John mentioned earlier. That's the current level that's offered, just say within the London area, not beyond that to other constituencies.
Maybe that was a bit too hopeful and it'd be probably quite definitive, but we had to ask it. And John, can I ask, financially, how viable is the gym to operate and what challenges do you face?
It's a difficult contract to manage for financial viability. It may actually come back to Tessa's original point about when the staff are saying about protecting the charity, they're more talking about trying to make sure that what the House are writing off as our debt position is reduced. But we haven't made a surplus at Parliament for the last 7 years. That's for a number of reasons. We know live membership is low, circa 500. We're a London living wage employer, so staff employment rates are when keeping London living wage. And coming back to Kirsten's point about marketing, we really are challenged with the way we can market the facility across the estate. And I think that might be because we're perceived as a commercial organisation working within Parliament, and therefore marketing membership sales or selling a product might be perceived as unfair marketing against other people who may have a private contract or a contract within the estate. And if we were a service and we're able to talk about wellbeing services across the estate and therefore much more openly talking about getting people and customers into the facility, I think we'll have a much better approach to signposting people to the location. There are a significant number of people who don't know the gym is there, who have been in an employee of the house for a long time, and I'm still amazed that people don't know the facility is there. And if you were to walk past through Portcullis House or any other corridor within the estate, you won't find signage steering people to Westminster Gym or a gym facility. The team are really good at trying to find ways that we can do this. So we have had examples where we've created little table stands that talk about healthy eating and a free pass that's set on the little tables in Portcullis House. We have had boards around the Parliament, so much like these screens here, that have been in corridors where we may have something pop up and have a 30 seconds, then another infographic comes up. But in terms of a strategic approach to, I don't want to say marketing the space, making people aware of the wellbeing provision, then it's heavily restricted.
Okay, it's helpful, Chair.
Thanks. Alex.
Thank you, Chair. Just, John, following up on that point, can I just understand what are the limitations when you talk about if you were able to present yourself as a service rather than a kind of commercial profit-making enterprise? What are the kind of limitations that prevent you from sort of doing that now and pivoting to that kind of well-being kind of space, which may pick up, volunteer membership numbers and footfall?
Yeah, I think price is still a barrier, although we charge reasonable rates. The parliamentary community is a community of people who represent society as a whole, from people on lower earnings to people on significantly higher earnings. And people who are on lower earnings may have a choice between their home life and they afford to pay a £30 gym membership. If we approach the community of Parliament like any other community outside, then we need to be making provision to these people to have access to physical activity, and cost isn't a barrier to that. Because I'm always trying to be mindful of us breaking even or reducing the cost to Parliament of that contract within it, we have to make decisions where staff teach classes as a part of their shift, so that we're not paying external instructor costs, which are typically about £25 to £30 an hour. So to put back in morning classes, for instance, we need to find an instructor who's teaching at £25 an hour. That person will come out and teach a 1 hour class, and a lot of people won't come out for a 1 hour, £25 session. But we need to build a case to try and bring those services back in. If our approach was much more of this as a service to house, and actually these costs, it's not a cost, we're actually improving the lives of parliamentary employees and therefore reducing the cost of conditions through to inactivity. Actually, we're reinvesting that money now, and we'll be seeing a saving long term in reduced access to GP services, days off sick, poor mental health.
That's really helpful. I guess what I'm trying to drive at is, so what's prohibiting you from doing that now? Is it a kind of contractual limitation with the house because it somehow would then trip into the it's not the effective indemnity of the house is giving you for any kind of shortfall in operating costs? Is it something else, or is it nothing? And actually, that is something you could do, but it has to be part. You might be saying of a broader strategy about where the balance lies, and do you offer more packages for people who obviously have lower salaries, and therefore to encourage them along in order to get the offset costs that you talked about? I mean, is that something you could do now and are looking at, could do now and aren't looking at, or can't do now? And if not, if it's that one, then what's the reason for you not being able to?
It's when we write a budget that tries to show that the income we generate from memberships at the membership rate we think we can sell it for then covers the operational costs, including staff salaries, and then what comes out of that bottom line. And if that bottom position is a significant net loss, then are we a viable contract in Parliament to offer as a private contractor? If the net loss is actually part of a wellbeing strategy, and it's not a loss, it's just an investment in terms of wellbeing, then it's a different approach to doing it.
Does that need to be part of, I guess, and goes to a question I was then going to ask about future vision for the kind of gym? We've touched on aspects of it through all the answers from yourselves, but is that something that then is a part of the conversation that you need to have with Wes and with the rest of the team in Parliament in order to, and what we can do as a committee with this investigation. I know what modernisation committee we're also looking at, which I'm also on, so I'll mention that now. As part of a reform strategy for this Parliament to look at, and whether contractual changes or instructions from Parliament need to follow, then that's something that could be looked at.
I think broadly speaking, I think a more holistic approach to health and wellbeing more generally would help this, and not looking at the very good departments and operations we have in place already with occupational health and wellbeing in the gym. Whilst we do work collaboratively together, there is a bit of silo work in there, and I think if there's an approach that would look at health and wellbeing in the whole, that will help drive this forward, which would include the gym in that, and almost look at the gym beyond just being somewhere that you go down and use a treadmill and do some weights. It's a health and wellbeing space, and it's how I think we can work, departments within the house work together to help with that.
I'll pause there, Chair.
Thank you, Alex. Bambos.
Thank you, and I should declare an interest that I'm a member of the gym, so, and I have used it in the last week, so just want to say thank you to the staff for being so helpful. So one question, it's to you, Jon, it's just about how you work with Parliamentary Health and Wellbeing Service to promote healthy lifestyles to those who work here. Obviously, you would get referrals, I imagine, from the Health and Wellbeing Service. I think Lauren mentioned Technique, who do physiotherapy as well. So that's one approach. But just wondered, how ad hoc is that? Do you have other? Do you have a more detailed relationship with the Health and Wellbeing Service?
Thank you. We do work with them. They are a fantastic team, and I've been working alongside the team for many years. And when they were based in not Richmond House, no, the other one, Millbank. When they were based in Millbank, I used to send instructors across to teach within their facilities to encourage people to exercise, and not necessarily come to the gym. Over time, and certainly since COVID, and maybe down to our locations and changing people, we are probably more reactive than proactive. We still work a lot with GP referral, so our GP referral manager will have people referred to them from Wellbeing. We support the Wellbeing team with any of their stalls they have in Portcullis House and the events they run for incoming MPs or parliamentary staff. So we talk about the gym provision alongside the Wellbeing provision. In previous years, we used to help with their smoking cessation and alcohol reduction programs to support parliamentary staff. But I think if we're talking about wellbeing in the whole, then I think a much more seamless integration with the wellbeing team, with the GP on site, with our physio, would probably keep that a little bit more seamless.
I think that would be helpful because obviously if your target is weight loss, then obviously gym is only part of that. So I think obviously linking it to nutrition and other things would be quite a good way forward. My next question is to Lauren. It's about how the gym works with the in-house occupational health service teams to support well-being.
Thank you. So the occupational health team, we essentially are helping patients get back to work. They will have a phase return back to work, and during that time they'll use our gym. They'll be referred to the physiotherapist and our exercise referral specialist, and they will have sessions getting them back to normal health. And once they've finished these sessions, we offer a concession membership, basically as a way to encourage them to keep using the gym to stay healthy, as long as it doesn't interfere with their working hours. Yeah, we offer a membership. We said with occupational health it would be 3 months on this concession rate, but that's hard to put a timestamp on when someone's going to be back to normal health. So it's 3 months, but we're open to extending it if someone feels that they want to keep using the gym on that concession rate.
Many people take up that concession?
Anyone who's used the physiotherapy or the exercise referral specialist has moved on to a concession rate. We don't have that many memberships. I think it's under 10. But the amount of people going through physiotherapy to then going to the gym is high. It's majority of the people. Yeah.
And Lauren, just again, how do you link with other in-house health initiatives? So things like, does the gym support things like park run type events and help groups who want to take part in exercise?
So I think this goes back to the vision of the gym. At the moment, there's no active collaborations. There's potential for it, and there's so much potential. You know, with park runs, we could set that up. We could do training. We could help collaborate with people to do that. At the moment, there's just no active collaborations. But like I say, the potential for health and well-being, we don't want it to be seen as just a gym. We don't want to just promote the gym for you to come down and use our equipment. We want to be able to offer other services and collaborate. Yeah.
Thank you.
Thanks, Chair. Morning, and thank you. What thoughts have you got on, and I'm going to guess not much, but the 26% of female users, providing specifically for menopause?
I'll go. I think, again, this is all in the vision. I personally am very passionate about women's health, teaching women about their health. I think there's not enough of it. I would love to use our gym space to do that, whether that is through workshops, whether it's through training, anything like that. At the moment, we're not doing anything towards it. But all these ideas that are coming at us, for me, that's just like, it's perfect. I want to be able to do that. I want to be able to provide a service where it is going to help women, you know, that 26%. I want women to come into the gym and feel confident, how to use equipment, having a space to work out, and actually being educated rather than just getting fitter.
So when women do come to the gym, are they encouraged to do weight training, for example?
It really depends. When people come to the gym, they're normally telling us what they want from the gym. So a lot of the time women will say, you know, they don't have a lot of experience with weight training, or they're worried about doing it in front of people. At that point, we will then say to them, you know, we can induct you, we can teach you how to do it. I guess moving forward, we should have a better strategy for that and make it like as part of the gym signing up, that we tell people this is something that we can do for you, especially for women. We have this service for you that you can do.
Nobody's actually trained or is advocating for resistance training for menopausal women, and looking at the bone health and looking at you know, the differences as your body changes and how cardio does nothing, and so nobody's giving that advice at the moment.
No, and I think that's an absolute fundamental step change into resistance training. Strength training is critical for perimenopause and menopausal women. Osteoporosis and bone health is critical. I think that if we're talking about identifying communities within the estate that we're working alongside, women's health is that community where we have women's lifting club in Covent Garden, and we need to be promoting much more about strength training. I often hear feedback from my team. Actually, I give my team extended lunch breaks if they use the gym, because an hour just doesn't do anything. And that comes back to leadership and management. And when I attended my menopause champion course, I was the only man in the room, and I was the only chief exec. And for me, that's a problem. And so if women are attending our facility and they've got to rush in and have a workout, rush out, then sometimes just that time is a barrier to starting. But when they come down, strength training, lifting weights, women's lifting club, and specific programs for women, absolutely we should be doing that.
I mean, this month is International Menopause Month, but this week is International Menopause Week, and Saturday is International Menopause Day. We as parliamentarians will be celebrating that with a backbench business debate, plus we've had other activity going on. It would be nice if the gym was actually doing something alongside that, which was specifically to encourage women to come in. I mean, one of the thoughts I had when you talked about the vision, and you can only hold 8 in the studio, is that you could maybe do something virtual, that you could have women in the offices actually doing it, whilst you have 8 people in the studio with a trainer, and giving nutrition advice along with the resistance stuff, and actually proactively get women to go in and talk about how they should be looking after their health. And not unrelated to that, because it actually comes with menopause, is weight gain. I am a woman of a certain age, and I am a Manjaro user. And I use the gym when I'm back home 6 times a week. I don't use it here because I just don't use it here. Are you doing anything specifically around helping? And there's a lot of us in here who actually are on that journey of weight loss. Are you doing anything specifically about supporting people who are maybe taking weight loss jabs but needing that extra support and encouraging them to use fitness as well as the jabs?
No, but that does raise a very important question about the jab in general, that as an industry, we're reacting to many more people now making that journey using GLP-1 or Manjaro jabs, because typically there's a time frame for usage. And if people aren't educated on movement and sensible choices and maybe some support in mental health, then actually when they come off, where does that cycle end and where does it begin again? And I think there has to be a full programme industry-wide to help people on that journey, because that drug will make a significant difference. But what won't help is that they have no understanding of what to do post.
That's a strategy. I mean, you guys...
There has to be a connected strategy. Otherwise, it's a very quick fix that actually will cause long-term problems in a year's time from now. But there's nothing currently at the Westminster Gym. But that's not to say that there couldn't be. And it does come back to my point really, which is about making sure that gym is a service to Parliament, exploring all these things which would be a cost to implement, an investment to implement, with a trained, qualified person who can take people through a full journey that might be 12 months as opposed to 20 weeks. But it's not going to generate a surplus. It's just going to be making sure that people have knowledge and the expertise to continue on that journey whilst they're an employee of the House.
Well, I welcome further conversations on both those issues. Thank you very much.
Thank you, Colin. Christine, do you want to talk about use of space as well?
I was actually going to talk about mental health.
Yeah, after that. You carry on. I'll
that's fine.
compliment your remarks.
Lauren and John, just following on from some of the issues that have been raised this morning, and we do know that menopause does significantly, or it can significantly impact on the mental health of women. What thoughts do you have on the gym supporting mental health more broadly?
I feel like the gym at the moment, like I said before, there is so much potential to have the team educate members on these specific things and help them through this. The gym staff are amazing at giving advice when it's needed, and when people come into us and they want advice on mental health or menopause or weight loss, we're really good at giving that advice, but we have no structure in place on like an avenue of people to go to help. At the moment, I wouldn't want to rush that. I'd want it to be well thought out. I'd want the people who are teaching these things to be well educated, also know enough knowledge. At the moment, the staff, they regarding the weight loss jabs, they might not even have enough knowledge at the moment, like moving forward, to give these good workshops, this education. So I think moving forward, it'd be a case of the staff as well being well educated, being able to give the information and having an avenue for people to go down, mental health being a big priority for people, especially in this estate.
I think it's fantastic to see that you're, all mental health first aiders. I mean, for me, that is a clear commitment. Are there any plans to roll that out to the other staff?
I think if the word Westminster Gym, I think ring fences it into a place of lifting weights and movement. And if we start thinking about a wellbeing hub or something where we aren't just selling a gym membership, it's a place in Parliament people come for physical health, mental health, social health, and within that environment they then do that activity in whatever location that is, but in close proximity. And with mental health, I think if we're looking at how we structure a gym provision, we'd be considering more studio-based classes to improve social health, so people have a connection to other people who have interests in common. We have spaces that may support people with neurodiversity, and that they're not loud banging space with bright lights and music, but they can still do physical activity in a space that supports that community. If we're talking about seminars and sessions around mental health, I work with the last 20 years in 2 of my sites. I have a hirer called Breathe, who have practitioners who do that, along with talking therapies and hypnotherapy. And making that very normal for people to come down and openly talk about their mental health as part of their wellbeing journey, so that we remove the stigma to it. I do think there's a lot more that can be done, but by reframing it away from the Westminster Gym and something else, it just stops people having that assimilation to, I've got poor mental health, I go to here, talking therapy. Or no, we can do a combination inside this location around wellbeing.
It sounds as if now is the time to have that wider consideration of what it is you want the gym to be, or what we all want the gym to be. Is it more about that, having a pure focus on the physical, or is it that broader look at it being both physical and mental health and well-being? So it'll be interesting to hear more about that as we move forward. Are there any new facilities or equipment upgrades planned in the next year?
We have got, I've submitted a budget request for kit to be replaced in 2 years' time. So the kit was replaced just before COVID, just before lockdown. So it wasn't used very much for 1 or 2 years. So it's coming towards the end of its life, although it's in good condition. So it will be due a refresh in a year or two.
Okay, good. I've got 2 further requests for short questions, because I want to try and wrap things up, because we've extended this session. It's been brilliant, but we've also got Al and other colleagues waiting to give evidence too. So it was Alex and Tessa. Alex, do you want to come in?
Yeah, thank you, Chair. And actually mine's just a request, actually, because I'm very conscious of time. We've touched on it in your answers to me, but also what we're just talking about now. Wes, it may be best with you, but maybe John, Lauren, you can obviously feed in. Could you perhaps write to the committee after this in order to explain how best we drive forward that holistic approach to wellbeing? Because I must admit, I'm still not entirely clear what you need from us. A report in and of itself, that just gathers dust on the kind of shelf, I'm not particularly interested in. So what buy-in from who, and what stakeholders you need would be great. And as part of that, because we didn't have time to touch on it, R&R, we won't delve into the limitations of the space as it currently stands, but what I'd be curious to know is this a factor of the R&R wellbeing? We talk about many different kind of resilience strategies. There's lots of different things that feed into R&R. Does wellbeing, health and wellbeing do so? And if not, then we need to consider that urgently, because that decision is fast tunneling towards us, as in very, very fast. And what the provisions are, not just for after, i.e., when R&R is complete and is it a new space for a gym, or wellbeing is central to that, what would the during journey be? Because there will be, a period of many years, whatever happens with R&R. So if you could consider those aspects in that letter, as well as what proactive, stakeholder engagement and other you need from us in their wellbeing, I'd be grateful. Thank you.
That'd be really helpful. Thank you, Wes. That would be good. Tessa, one last question on this session. No, you're done? Okay, brilliant. We did go overrunning a little, but it was worthwhile. Thank you, Lauren, John, and Wesley, for your evidence today. We'll write it up, and you'll get a copy, and it'll go into our general review of this overall topic. So thank you for your evidence this morning. Thank you. So we're going to close this panel, and then in 30 seconds or so, we're going to open up panel number 2. But thank you, and you can stay if you want.
Okay. Thank you, Chair.
Order. Thanks for coming back to panel 2 in our discussion on health and wellbeing today. We're joined by Al Carnes and Marcus Hudson. It's really good that you're going to give evidence as gym users. Let's kick off. Over to you, Al.
First of all, I'd just like to say thank you very much for sitting on this committee. I think it's really, really important. I'm a brand new MP, a year and a half in, so I'm way out of experience compared to some people on the panel. So I thought it would be useful, perhaps a fresh look at the gym and in particular health and wellbeing services that are provided. I spent a lot of time in gyms over my career, in and out of various environments, whether that be Afghanistan or the Middle East, all the way through to gyms in various military establishments, and then ended up here and became a member of the Parliamentary Gym at the start of my parliamentary career, and I've been going there probably 4 or 5 days a week, every week that we've been sitting. What has been really interesting for me is, and I'll be really honest, is the disparity between the services provided and, in some cases, the lifestyle that is demanded upon MPs and their staff within Parliament. And I'd like to caveat that with, I think the staff in the gym are amazing. They're really good people, they're knowledgeable, they know exactly what they're doing, and they're excellent. But I think they don't necessarily have the correct facilities or the capabilities to match it with the standard and the pressures of parliamentary life. Why do I say that? We have a diverse workforce. We have young people, all the way down to 18 with work experience, all the way up to people in their latter stages of life, which all demand very different facilities and classes and requirements from a health and fitness facility. And that could be anything, as mentioned before, from menopause advice all the way through to mental health, through to some heavy weights and big bars and CrossFit capabilities. We have a large workforce. There's about 15,000 people roll in and out of this area. And that provides actually quite a lucrative group of individuals that are short in time, want to stay fit and healthy. But yet we only have a 3.7% take-up in the gym itself. And so there's a disparity there somewhere between either the work requirements of being in Parliament and in the parliamentary system, or the standards of the gym, or perhaps both, aren't being matched correctly to deliver the right fitness facilities for the career that we collectively have embarked on and our staff help us out with. Why is it important? Exercise as a whole reduces risks of major illnesses, coronary heart disease, strokes, type 2 diabetes, early death by up to 30%. Preventative healthcare is the key area. We are the sick man of Europe. We are the people look at us as leaders, whether we like it or not. And there is an element of we're taking care of ourselves and collectively sets a standard, but also it helps us operate more effectively as members of Parliament or indeed individuals in Parliament by taking care of our health and well-being. 82% of people state that regular activity is important for mental health and well-being. But yeah, we only have a 3% uptake. Now, that may not include the 10, 15, 20% of people who use gyms outside of Parliament. But I do wonder if we need to improve our facilities and our standards to increase our uptake, increase our productivity, and importantly, increase our health and well-being across both our MP staff and our staffing structures that support us in delivering our job. Where are some of the sections that I think we could perhaps improve? The first one, and I didn't really know the word to put this, but I put it as attractiveness or welcoming. The gym itself is in a basement. I'm sure you will all have been there. It is in need of sort of refreshment and repair. There are facings missing. The showers in some cases are way out of date. The changing facilities don't have hangers for your suits. You can't have a locker and keep a locker. You've got to take a locker. You've got to lay your suit on the bench when you need to get into it unless you hang it on your wardrobe, which usually bangs into 3 or 4 other people to your left and right. My point being is one of the hardest things about going to the gym is actually going to the gym in the first place and getting out of your bed and actually convince yourself. And you use any excuse not to go to that gym, and I do that regularly. One of the excuses is if it's not a welcoming place to go to the gym, people necessarily won't buy into it. And so there is a bit about refreshing it and making sure it's I would argue, a polished and modern facility. And when I mean that, I mean repairs, modernised equipment, changing rooms that are suited for people who are in a rush and only have a very short period of time to squeeze in some fitness or indeed health and wellbeing care. There's also ease of access. It's 7 in the morning and it closes at night, yet most of modern gyms now are 24/7 access. Can we have a look at facilitating that? It's an insurance issue, but there is something about having an open access gym. If we need to put CCTV in there or whatever, then that would be fantastic. The amount of times I've finished at sort of 10:30 and I'm like, I could probably squeeze in 20 minutes and the gym's not open, means that I've got to do it in a different way. There's a requirement to refresh the locker system. One of the biggest problems is space and travelling with your gym kit back and forth. We've also got London rates of both pay and affordability, but importantly, from my perspective, the in some cases, for our staff in particular, the pain of living in London, having to travel long ways. It's much easier if they can conduct all of their both professional and sort of well-being activity in one place rather than having to bounce between different locations. Usually the biggest problem is storing your suit or your work clothes. And then I'll just talk about the variety and the sort of broad breadth of services. We've got a 3% uptake. We've got a diverse workforce. Are those services and classes that you would get in a normal gym outside of government, are they fit for purpose and are they attractive to our workforce? And are they run at the right times? It's a very difficult circle to square because of the amount of time we have to put into it. But there is something about making sure there's a breadth of services available. And then I just mentioned the affordability piece. £45 a month is, in some cases, way above normal gym rates outside, whether that be any of the big gym companies that provide 24/7 access, modern equipment, modern classes. And I wonder if that's right for our workforce. And I'll finish off without ranting. Again, I'll go back to the staff are doing a fantastic job. I wonder if we only have such a low uptake in the gym, whether that's actually because the gym isn't fit for purpose in the first place. And I think a modern, fresh, welcoming gym with a breadth of classes, with the right atmosphere, would attract many more people than we have in there today. That's me.
Thank you, Al. Marcus, tell us how you use gym. What equipment do you use? What classes have you used?
Thank you, Chair, and the committee for having me. I used the gym when I was in Parliament between September 2024 and September 2025. I would go typically 4 times a week, like Al. And I've been going to the gym for a very, very long time. And that meant that no matter what the facility is like, even if it is a little bit lackluster in places, I don't need that much motivation to go. So I would go 4 times a week. I'd typically use the weights, I would use the cardio equipment sometimes. Classes, not as much. But I went so regularly because it's a habit that was made over like 7 years, 8 years. And, I know this isn't exactly what you asked, but for young members who haven't gone to the gym before, I think the barrier to entry, especially for this facility, is quite high, especially with the cost and the quality of the equipment, and just because it's not very welcoming. It's in a basement, as Al said. So yes, I would go 4 times a week, but I would attribute that more to the fact that I've been going for a very, very long time, not down to the facility itself.
Okay. Mary.
Thank you, both Al and Marcus. And I think you might have touched on this a little bit, but could you say how you think the cost compares to health facilities elsewhere that you may be aware of?
I think in some cases double the cost. I think in some of the more 24/7 open gyms, and I understand they have a bigger uptake, so they can perhaps reduce the costs. But I think it's far more expensive than many of the gyms I've been members of, whether that be back in the constituency.
Where do you sit?
Say again?
Where do you sit?
Birmingham, Selly Oak. So some of the big gym groups that you get have lower costs because they have a bigger footprint. But I do wonder if, and it's less so, and I'll be honest, it's less so for me, but it's more for the staff that we have here. If we want the uptake, you've got to lower the cost. It's just not affordable for them. And I think it's quite difficult for them to afford that.
Yeah. And could I add to that? So I did a little bit of Googling before I came. The Charing Cross gym group is £37 a month, and that's a peak time membership. If you wanted to sign up for a 12-month fixed term pay in all one go contract, it'll be 33 a month. And when you start to go into zone 2 or zone 3 or zone 4, typically where other staffers live, because we can't afford to live in zone 1, obviously, it can get down to 32 or even down into the 20s. And I've shown quite a lot of people around the gym because I'm quite keen to spread the message. You know, this is so important for my work. I could not be as good as my job if I didn't use the gym. And I've shown so many people around, probably 4 or 5 over the last year, typically around my age, and they would say to me, it's too expensive. Why can't I just go to the gym group for 30 quid a month outside my house? Or they would say to me, oh God, it's not very welcoming here and it's tiny. Why would I go when I could spend 10 quid less for somewhere better? And I'd just like to caveat that answer and the rest of my answers with the fact that the staff are lovely. It's nothing to do with the staff. I'd particularly like to name drop Christian and Stefan, who work there. They are lovely, but frankly, it's not worth the money.
Bambos.
I'm going to caveat this by you're both incredibly fit people, and Al, your endurance feats are legendary. So, so I just want to start by saying, does the gym actually meet your physical goals? Your physical activity, does it meet the goals that you're setting yourself for? And I know you both exercise on a regular basis.
Yeah. I think I would say my standards are actually quite low in this space of where I've been. Wherever I go, I can find somewhere and somehow to train. But I would argue as the diversity of training, and I do quite a lot of weights and sort of cardiovascular activity, as diversity of training has changed, the kit in this gym hasn't changed with it. And what I mean with that, more body work facilities, things like, and not the company itself, but multi-purpose frames. For example, the roof is too low. If you want to do pull-ups, you've got to remove the panels in the roof so your head can go up into the roof and back down. If you want to go to the stepping machine, you've got to remove the panels in the roof because your head, but now I'm quite tall, that's not for everyone. But the area it's in reduces the flexibility of the use of the space. So I don't think it's kept pace with the times. It's probably not the individual's fault. It's actually probably the space and the constraints of the location.
Good. Alex.
Thank you, Chair. And this is a question to both of you, Al and Marcus. In terms of mental health, what more do you think that the kind of facility and the provision of services could be doing in order to further kind of well-being and mental health support from what it currently does, and what more it could actually be doing?
I think, and I've got quite a lot of experience in this from my military background, but also my last year working as the Veterans Minister and looking at how mental health provision. I'm not an expert in any way, shape or form, but I would start with the first bit. Is it a welcoming place to go? And if the answer is no, then we failed the first step. Because people won't necessarily come with a mental health issue. That mental health issue may come out after a bit of engagement or, a bit of consistency in going with the gym. These systems often work the best where you combine your mental health facilities, nurses or individuals or specialists in with the gym itself, and so people can pick up on certain atmospherics and then help people with those issues. I'm a big fan that, and as I mentioned, the statistics that physical activity increases mental resilience. But a comprehensive package in the same place, I think, is the answer.
Yeah, so I just want to follow on from what Al said. I think with this discussion, it's important to note that physical health is the same as mental health. Regular exercise promotes mental health. I don't think it should be seen as isolation. So I think the main thing we need to do is just make it more accessible, either by lowering the cost or making the facility better and more welcoming. I think one really easy win for the gym here is just to make people know that you can get a free trial. No one knows that. I mean, that might be a little bit pedantic, but I've asked a lot of my fellow staff members. No one knows you can go one time for free, so that would be something easy to do, introduce them. And make it known that they can go one-off. And yeah, just lower the cost or make the facility bigger and more welcoming, because currently the barrier for entry is just far too high, especially for new members. If you go down there and you think, oh, Jesus, do I want to work out here 4 times a week? You know, I think the answer often is no.
Yes, I mean, you've both been quite critical of the location and the facilities within the location, given the constraints of where it's sited. Are there any facilities that could be added that would enhance the position for staff and also for members of Parliament?
I think a complete refurbishment would be required to make it more welcoming. I actually think we might want to step back and look at this, whether we're doing it right in the first place. Is having a small gym in the basement of Westminster the right solution for such a large and diverse workforce, or is there something, it may be longer term, maybe medium term, but is there another solution that is a Whitehall gym rather than a Westminster gym? I'm not sure, but I think if we're to do some critical analysis of what is lacking, I think you're probably unlikely to get where you want to be given the geographical location of the gym. And therefore we may want to explore other options, discount those options, and then return to that question, say actually it's about minor or marginal improvements and we've just got to like it and lump it. Or maybe there's a different solution, whether that be across Whitehall rather than Westminster, in combination with other government departments. I don't know, I'm making this up. Or there's a deal to be done outside with a bigger gym group that has better facilities.
So just to come back on that, so if it was to be contained within the parliamentary boundaries, because of security issues, what extra facilities would you want to see in an enhanced gym?
Yeah, so I would like to see it fully refurbished. I'd like to see more cross-functional exercise equipment, such as what we call the Beaver Fit frame, which is difficult because of the roof. I'd like to see more classes available at more flexible times. I'd like to see it 24/7. And I'd like to see the equipment updated on a regular basis to ensure it's keeping pace with the most modern physical equipment.
So classes could obviously use the equipment, or they could be held
exactly
in an open area.
Spinning classes, whether it be circuits, whether it be different types of fitness fit for various different age groups, size and shapes across the parliamentary estate.
Okay, thank you. Marcus?
Yeah. Just to follow on from that, I think if it's moved somewhere else in the parliamentary estate, I would say 50% more space. That would be fantastic. Ideally somewhere with natural light. I know it sounds a little bit arbitrary and not very high priority, but it does make a massive difference, especially if you're new to gym and you want to sign up. Being somewhere with natural light, I think, is so important. And I would say, in terms of the specifics, just more weights, more than one squat rack, and more than one bench press, etc., more cardio machines. Just a bigger facility, I'd say. And then also the changing rooms. Going back to Al's point, a significant improvement there. It actually, there's typically a puddle next to the showers. Again, a minor point, but you know, if you're worried about slipping up on the floor, moths as well. I think that could be improved.
Yeah, interesting as fitness it goes through fads. It sort of goes up and down, CrossFit, High Rocks, we go up and down and so on. I would argue some of the equipment hasn't tracked some of those changes. And that's not to say we've got to change the equipment every time a fad comes up, but there's some multi-purpose equipment that's missing from the gym in particular. The changing rooms is the biggest bugbear for me, when you've got to go down with a suit and your physical kit, you've got nowhere to put it. There's no hanger. There's no even hangers on the wall to hang your suit up, so you've got to lay it on the bench and then it falls on the floor and it's wet because there's puddles, because the drainage doesn't work. The showers are slightly decrepit. I suppose my point being is, and I've been in lots of gyms. I will continue to use that gym, but if we want to increase the membership and increase the health and well-being of our MPs and our staff, it's got to be more attractive and cheaper to go to.
Thanks, Bob. Alex.
In terms, just very quickly picking up on what you were talking about, and it's the point Bob's talking about, is what emphasis one puts on proximity and obviously security, albeit with the evidence we heard earlier, the data suggests that in 2025 only 13 MPs go, whether that's regular or one-off. Obviously got a regular user in front of us, so but of course you delve into that. Is that because of lack of knowledge? Is that because of cost? Less so perhaps for members of Parliament, obviously, but for certainly members of staff, as you've said, Marcus, very eloquently. Is it because of attractiveness? All of these things, and that goes, I think, to your point, Al, about do you look at a bigger partner across the across the Thames or further afield. So I think that's something that we probably have to think about a little bit more offline. In terms of the gym's current integration with kind of other health and wellbeing activities, how well do you think that is done? So if you think of other sport communities, football teams, parliamentary teams, is that done well? Could it be done better? And would that perhaps bring in some more people, Marcus, because people might then get a bit more exposed to something they just don't have awareness of? I don't know what your thoughts are on that.
I mean, I'll give it over to Marcus in a second, but I think it's all linked, isn't it? We've got the parliamentary nurse, we've got mental health facilities. Imagine it was all in the same place, where the mental health nurse could say, hey, listen, we may want to explore other avenues to get the positivity back. Why don't we do some exercise twice a week, 3 times a week? That's not the only solution, amongst other sort of multifaceted approach. They're often best when you go to football teams or indeed in military establishments. They're often all combined. Your rehabilitation centre, your mental health, your physical activity is all in the same spot. Interesting, in the last place I was based, we just built a new rehabilitation centre and it's all in the same place. One-stop shop for health and wellbeing. And it's fantastic because you build up data, you build up insight, understanding. It's a welcoming place to go, and the uptake went through the roof. Whereas before you might have to go see the nurse, then go to the gym, then go see the physio. They're all different locations. And that's an ideal world. We've got constraints here. I absolutely get that.
But I think it goes to the point you may have heard me talk about before about R&R, about what the kind of plan, what the thinking about this is in the current build of it, and whether or not, and I know Wes is very kind, said it's going to follow up with some written evidence to the committee on that, but I think you're right, that feeds into that and what the parliamentary community looks like in terms of health and wellbeing over the next immediate and short and medium and long term.
Can I just give it a comparison? In the military, you're exceptionally busy. You're bouncing around all over the world. It's quite physically arduous. As an MP, you are exceptionally busy as well. It's slightly different, but it's just as busy, if not busier. But the facilities are way less available and less a lower standard for MPs and political and public service than they are for the military. Now, I understand why, but in some cases, there is an element where we need to modernise what we deliver.
Yeah, going back to your point about integration, over only 1 year of being in Parliament, I was added to, I think, 2 or 3 different WhatsApp groups which said New Run Club in the title. I think there is a big demand for a more sociable group supported by either the Jubilee Hall Trust or Wellbeing Services in Parliament. I think there is a big demand for these services, and maybe if I had even more friends in Parliament over the last year, I would have been added to even more similar group chats. There's definitely a demand for these kind of things, and I think that the gym could be instrumental in doing that.
Maybe something they can take away and we can pick up as well. Thank you. Thanks, Chair.
Thanks. Nab, last question.
Thank you. Can I thank Marcus and Al for the contribution and also the speakers from the gym. It's more of a comment rather than a question for you, Chair. I think this goes back to the sort of conversation, particularly in terms of the cost of the gym. Every year or every 18 months when we have the discussion about catering price rises, it's always raised that price rises disproportionately impact staff, low-income staff that work on the estate. But also the argument is made that catering services operate on the parliamentary estate without paying rent, and often the commercial offer available, if you go to the Strangers Dining Room, is more expensive than what's available commercially outside. So it's sort of a similar argument that I don't know if the gym, the trust pays rent here. I don't know. I imagine Parliament owns the Portcullis House building. If there's no rent being paid, perhaps there is an argument to be made. Now, I accept obviously the point that Al made in terms of Pure Gym or whatever, the gym group. In my constituency, you can get a subscription for £16 a month, peak subscription, which is a lot lower than London. And I get it's obviously 200 miles from London. But perhaps there are some staff, if you look at IPSA pay bands, who are on £25,000 a year working in Zone 1. So it obviously impacts them a lot more, £46 a month, whatever it is. So maybe something for the committee to think about in terms of the cost. Yeah.
Okay. Yeah, and diet and all the other wider issues you raised. Thank you, Nav. Well, we've covered a lot of ground and at speed. So thanks, everybody. Thank you to all our witnesses for talking to us today and answering our questions about the gym and fitness. And can we express our thanks particularly to all those who work at the Westminster Gym for the good stuff you do and supporting health and well-being for all of us who work here. We're going to conclude this session, but we are returning to this issue as part of a wider inquiry over time and look forward to taken it forward. Thanks again.
Thank you.